These stands for appearance, behavior, speech, affect, thought process, thought content, and cognitive examination. This atin dito, this can be seen in the MSE part of our history token sheet. So for the appearance, the first part is the appearance. If the experience a specific diagnosis might immediately suggest itself. So for example, a disheveled man wearing bizarrely mismatched pairs of clothes might suggest that the patient is schizophrenic. However, a flamboyant and seductively dressed woman with bright makeup who bounces into an office with energy to spare might suggest that the patient is in a manic episode. The qualities to note when examining the patient's appearance include self-esteem, personal statement, and their memorable aspects. For self-esteem, one might ask, does the patient care about his appearance? In this case, the book gave two examples. The first one would be the patient was a mildly overweight man with unruly black curly hair, dressed in ill-fitting baggy jeans and a t-shirt so tight that his stomach was visibly bulging above his belt. The other example would be a patient was a slim man who appeared younger than his 47 years with fashionably cut or short brown hair, an ironed button-down shirt, blue jeans, and polished penny loafers. So, in this case, both patients were diagnosed with depression, but presented very differently and required different treatment plans. So, as we can see, there are other medications that are better to be given among obese or overweight patients. The next one would be personal statement. Does the appearance say something specific about your about your patient's interests, activities, or attitudes? So this patient came into the office dressed in a pressed electrician's uniform with his name stitched over his breast pocket. He wore a t-shirt with the slogan, "Every day I'm forced to add one more name to the list of people who piss me off." So as you can see, as you can already tell, since the patient walked in with a uniform, so you can tell that the patient's work as an electrician, and then you could also tell that his attitude was what do you call that? Not so very engaging, or he might have a very intimidating attitude. For the memorable aspects, describe whatever particularly strikes you about your patient. For example, if he or she is particularly attractive, note it. So note that the patient is attractive, since degree of attractiveness is usually relevant to self-image. In describing unattractiveness, describe the unattractive aspects instead of writing the word itself, since it will suggest that you dislike the patient. So we usually don't write the patient is unattractive or untidy. However, we describe if the patient is unattractive, we describe how. So in the example in the book, this was a man of normal build who had a round, acne-covered face and was essentially bald, with the exception of a small amounts of oily black hair on either side. Another example, she had short, curly brown hair, and her left eye was congenitally deviated toward the left, giving her a somewhat unsettling appearance. So as you can see, uh, the example did not write directly that the patient is unattractive. However, he described it. So these are some of the descriptors with regarding the aspect of appearance of a patient's hair, facial hair, face, etc. So ito yung mga descriptors. Just take note. You can actually use this to describe the patient's appearance. So for behavior and attitude, how did your patient behave toward you when you first met him or her? Was she friendly and cooperative, indifferent and apathetic? Did she sit right down and face you? Or was she agitated, pacing around the room and talking rapidly without really attending to your questions? Descriptors of attitude are similar to descriptors of affect. However, the emphasis is on words that describe a relationship towards someone. So these are the terms used to describe the behavior of a patient. So we have appropriate, calm, or happy individuals or patients. We have cheerful, bright, and the rest. Again, for behavior and attitude, the book presented examples. So the number one example would be he presented himself as someone who was very anxious to tell his story and to gain relief from his symptoms. He had an attitude of submissive respect, saying things like, "Do you think you can help me, doctor? What do you think I have?" Another one, another example, he presented as indifferent and apathetic. Her general attitude was that this was just the latest in a long string of unhelpful interviews. And the last example, he was initially reluctant to answer questions and seemed irritable. Over the course of the interview, he became more self revealing and fearful. So, often your patient's attitude toward you will change over the course of the interview. So, you just have to take note of that if there are changes during the interview. For speech, description of speech has greatly overlapped with description of thought process. This is because we can only know our patient's thoughts through speech. So the qualities of speech to consider include rate, volume, and latency of response. For rate, does the patient speak rapidly or slowly? Rapid or pressured speech is usually seen in manic patients. For volume, patients who speak loudly may be manic, irritable, or anxious. Very low volume may signal depression or shyness. For latency of response, normally when one is asked a question, one will think for a fraction of a second before responding. However, in manic patients, they may respond so quickly that they seem to jump onto the last words of your questions. Similarly, in depressed individuals or psychotic patients, they may show an increased latency response, waiting several seconds before answering simple questions. Another quality of speech to consider would be your general quality. Does the patient speak thoughtfully and in an articulate manner, or does she ramble in a vague and disconnected way? So these are the different speech terms that are usually used to describe the patient's speech. So another one among the elements of the mental status examination would be your affect and mood. So mood is defined as a patient's subjective report of how he or she feels. Affect, on the other hand, is defined as your own impression of his emotional state. So objective siya. So your approach is, for example, when you ask the question, how do you feel right now? How has your mood been over the past few days? So if a patient answers with a vague term, follow up with questions aimed at giving a more refined name to a name through the affect. So a name on which you both can agree but which you have not fed the patient. So parang i-guide mo yung patient na mas ma-show na yung ano, ma-show na yung kanyang tawag nito, ma-describe niya kung ano yung nafe-feel niya. So in this example, the interviewer asked, how have you been feeling over the past few days? So the patient replied, not so great. Not so great. Can you give that feeling a name? Patient. Just really lousy. Interviewer. I mean an emotion word like sad, nervous, angry, and so on. So patient, sad, I guess. So as you can see, uh, although the patient gave a big answer, no, not so great. Somehow the interviewer tried to evoke the patient to give that certain feeling a name. So in order to do that, the interviewer guide the patient to an emotion. So he did not directly spread the patient the particular emotion. Like hindi niya sinabihan na malungkot ka ba? But rather he gave options like, are you sad? Pilipay ba ka? Nasuko? Napulbaan? So the patient replied by saying sad, which also for the interviewer, nag-agree din siya based on what he saw. Another example, interviewer, how have you been feeling over the past few days? Patient shaking head, looking at an interviewer intensely. So, he answered totally up and down. Again, another vague answer, no? Merong mga ganun na patients. Interviewer, tell me about the downs first. When you say down, do you mean sad or depressed or something else? So the patient was guided accordingly, and then he replied, really depressed. So furthermore, the interviewer, parang nag-ano pa siya, gusto pa niya elaborate further. Do you feel depressed nearly every day? Sometimes I get really happy. Interviewer, I want to talk about the happy times. To focus on the down times, do you have depressed periods nearly every day? Patient, yes. Interviewer, is your concentration affected during those periods? And so the interviewer goes through the neurovegetative symptoms of depression and determines that the patient meets criteria for a major depressive episode. So again, the interviewer asks, now tell me more about the really happy times you've been having. What do you mean by ups? So the patient replied, feeling great, feeling on top of the world. So again, this is one particular difficult situation is when your patient says he or she feels up and down. So this is the example, no, or that he has mood swings, because generally mood swings or that feeling of up and down may be present in patients with bipolar disorder, depression with mood reactivity, cyclothymia, PD, anxiety disorder, or any substance use disorder. So the interviewer proceeded by asking, okay, do you feel great nearly every day? The patient then answered, no, not every day, but sometimes I do. Interviewer, over the past 2 weeks, how many days would you say you felt really great? Patient, oh, a couple. My parents gave me a car for graduation. I was so happy. Interviewer, how long did that feeling last? So the patient replied, a couple of days. Interviewer then asked, how did you feel? Then the patient replied, down I should squat. So with this MSE and with the history presented before, the interviewer was able to diagnose the patient as having MDD. So for
For
qualities of
qualities of
affect,
affect,
you have to take
take
note
note
these different categories. Number one, stability of affect. This refers to a continuum from stable affect to labile affect. So, marked lability of affect, as when you see a patient alternate between giggling and uncontrollable sobbing, is usually a marker of either mania or psychosis. So another quality is appropriateness. So a patient who laughs uncontrollably while talking about her mother's death is exhibiting inappropriate affect, as seen in psychosis or mania. Another quality to affect is rage affect, in which depressed patients are said to exhibit constricted affect. In schizophrenia patients, they often exhibit flat affect. For intensity of affect, it is often hard to distinguish from range of affect. However, it has three grades: intense, flat, and blunted. Flat and blunted affect are usually reserved for descriptions of severely depressed patients or patients with negative symptoms of schizophrenia. So again, flat and blunted. Intense is often used for manic or histrionic patients. For thought process, this refers to how the patient's thoughts are formulated, organized, and expressed. Normal thought process would be described as being linear, organized, and goal-directed. For flight of ideas, this usually refers to rapidly, this usually refers to having or jumping from one topic to another, so rapidly moves from one thought to another. All of the ideas, however, are logically connected. In circumstantial thought process, this over includes details not directly relevant to the subject or an answer to the question but does not eventually return to address the subject or answer the question. In a tangential thought process, the patient never returns to the original point of or question, and the answers are irrelevant and related in a minor, insignificant manner. For looseness of association or loose thoughts,
It is difficult or impossible to see the connections between the sequential content. In perseveration, the patient has a tendency to focus on a specific idea or content without the ability to move on to other topics. And the patient will repeatedly come back to the same topic despite the interviewer's attempt to change the subject.
Mon.
Yes po, Doc.
Dali lang daw, Mon. Ah,
Doc, tama po
ah,
kayo, Doc.
klaro ba ang tingog ni Raymond sa uban?
Copy po.
Yes, Doc.
Klaro lang.
Ay, dili klaro, Doc. Dili klaro.
Copy, Doc. Copy po kayo, Doc.
Kaya daga putol-putol sa kuan, naglisod kog paminaw. Dira po sa inyo?
Wait lang, Doc.
Sa ako po, Doc. Dili ko ka klaro, Doc. Putol-putol.
Okay. Same lugar mo tanan?
Murag kita tanan, Doc. Doc. Hello?
Five kami diri Dok sa quarters, no?
Namo tanan dara?
5 lang, Dok.
Asa si Raymond? Quarters po?
Quarters po, Dok. Medyo nagahina man gud ang logo.
Mole. Palunga sa daw na inyong mga
Bigyan po siya.
Doc,
Bigyan po siya.
ha? Chapi, Doc, chapi.
Kaya naman na ano. Sa ating ano.
Sige daw, Mon. Storya daw.
Hello.
Klaro po.
For perseveration, again, it is the tendency to focus on a specific idea or content without the ability to move on to other topics. So also in perseveration, the patient will repeatedly come back to the same topic despite the interviewer's attempts to change the subject. In thought blocking, this is a disordered thought process when patient is unable to complete a thought. Patient may stop mid-sentence. Also, patients will often remark that they don't know what happened and may not remember what was being discussed. In neologisms,
This refer to a new word or condensed combination of
this refer to a new word or condensed combination of several words that is not a true word and is not readily understandable. In word salad, this is characterized by confused and often repetitious language with no apparent meaning or relationship. So for thought content, this is actually what thoughts are occurring to the patient. So in the book, by Kaplan, you have your obsessional thoughts. These are unwelcome and repetitive thoughts that intrude the patient's consciousness. You have your compulsions, which are repetitive, ritualized behaviors that patients feel compelled to perform to avoid an increase in anxiety or some dreaded outcome. And you have your delusions, which are false fixed ideas that are not shared by others. So we have your grandiose delusions, persecutory, somatic, and others. You also have your suicidality and homicidality. So when assessing for suicidality and homicidality, we have to ask for the patient's ideation, intent, plan, and preparation. For cognitive examination, the elements of cognition that needs assessment would include number one, level of awareness or wakefulness, attention and concentration, memory, judgment, and insight. So we have to take note that in low educational attainment, which is defined as fully educated or as 8 or fewer years of education, so usually yung mga hindi nakaabot na high school, which would correlate to poor performance on cognitive testing. So therefore, before doing cognitive examination, one must always ask for the patient's educational attainment to avoid overinterpreting the results in poorly educated patients. So for level of awareness or wakefulness, this range from comatose to fully alert. Remember, a full cognitive examination is not valid in a patient who is nodding off throughout the interview. So the importance of knowing the level of awareness is that it will give clues in certain diagnoses such as benzodiazepine or alcohol abuse in the drowsy patient or mania, or stimulant abuse in the hyper-alert patient. Also, it will give guidance in how to proceed with the rest of the cognitive examination. So your first 10 seconds of contact with the patient will tell you whether he or she is alert enough to greet you appropriately and tell his or her name. If the patient is sleepy, describe the degrees of sleepiness. So you have sleepy, drowsy, lethargic, somnolent, stuporous, obtunded, and comatose. However, since there are no generally agreed on definitions of most of these terms, it's best to describe the degree of sleepiness in plain English. So in the book, the example is for stuporous and drowsy. So the first example would be for stuporous, wherein stuporous is described as the patient was sleepy and could not be awakened by calling his name loudly and shaking his shoulder. So for drowsy patients, it was described as the patient yawned frequently during the interview, but attended well to all questions. The patient nodded up frequently and had difficulty resuming his train of thought. Yeah.
For
For
attention
attention
and
and
concentration,
concentration,
which
this
is used to assess
is
whether
used
the
to assess
patient
whether the
can
patient
sustain
can
attention
sustain
over a period
attention
of
over a
time.
period of time.
Attentive and focused
Attentive
to
and focused to
confuse,
confuse and
attentive and focus,
tapos
tapos
confused and
confused and
distractible.
distractible.
So yun yung mga range nila. There are
There are
two
two
tests
tests
for
for
assessing
assessing
attention.
attention.
You have your digit span test, wherein the patient is given 5 to 7 numbers and asked to repeat them forward and backward. And you have your serial 7 subtraction test. So the best way to assess attention and concentration is simply to talk to your patient and observe how or she thinks. So is he or she able to concentrate on your questions, or can he or she maintain a train of thought as he or she answers you? If the answer to these questions are yes, then your patient's attention is intact.
For
For
memory,
memory, assess both short-term memory or memory of things learned a few minutes to a few days ago and a long-term memory, which are memory of things learned longer than a few days ago. Most clinically valid tests are orientation, three-object recall, recall of remote personal events, recall of general cultural information. For orientation, usually the test of memory is to ask for the patient's orientation to a person, place, and time. If a patient is taking a while and struggling to remember, then ask for specific components from easiest to hardest. So, for example, sa time. So, you begin by asking the patient what year is it, because it's generally easier to determine the year. And then this would be followed by the month, and then what day of the week. And as much as possible, you try to collect everything. So you ask for the entirety of the day. And then don't overinterpret an accurate date. In recording your MSE, rather than writing, patient was not oriented to date, record instead what the patient said. Kasi there are times that the patient will just be off by 1 to 2 days. But it does not mean that the patient is not oriented to time already. So to correct that error, or to prevent that error from writing not oriented to date, you just record what the patient said. For three object recall, recall of three objects after at least 2 minutes has been shown to be a useful test in diagnosing cognitive impairments. So example, repeat the following words: ball, chair, and purple. Make sure that the patient is able to repeat the words correctly before moving on. In the meantime, ask patient about several general knowledge questions. Then ask him to repeat the three words after 2 minutes. If the patient has trouble, use hints to help the patient remember. So for the hints, in the example, ball, chair, and purple, so you could provide hints to the patient, like, for example, saying that one of them is something you can play with, and then one is a piece of furniture, and then one is a caller. So normal people usually remember all three rules, and if they forget one, they will remember it after you give hint.
For
For general
general
cultural
cultural
knowledge,
knowledge,
the
the
traditional
traditional
task is
task
to
is to
name the
name the
last
last
five
five
presidents.
presidents.
Or
Or
the
other
other
tasks
tests would
would include
include
naming
naming
other
other
famous
famous
figures
figures
and
and
famous
famous
dates.
dates.
For
For
personal
personal
knowledge,
knowledge,
include
include
aspects
aspects
of
of
current
current
life
life
as
as
memory
memory
of
of
remote
remote
personal
personal
events.
events.
So
So
you
you
can
can
ask
ask
about
about
the
the
patient's
patient's
current
current
address
address
and
and
phone
phone
number,
number,
the
the
names
names
and
and
ages
ages
of
of
spouse,
spouse,
siblings,
siblings,
and
and
children,
children,
spouse
spouse
birthday,
birthday,
wedding
wedding
anniversary,
anniversary,
and
and
date
date
and
and
place
place
of
of
marriage,
marriage,
and
and
parents'
parents'
names
names
and
and
birthdays.
birthdays.
For
For
intelligence,
intelligence,
one
one
can
can
get a
get a
general
general
idea
idea
of
of
level of
level of
intelligence
intelligence
via the
via the
rest of
rest
the
of the
interview.
interview.
High
High
levels
levels
of
of
educational
educational
and
and
job
job
attainment
attainment
usually
usually
correlate
correlate
with
with
high
high
intelligence.
intelligence.
So
So
that
that
is
is
why
why
it is
it's
important
important
to
to
ask
ask
the
the
patient
patient
early
early
on,
on,
especially
especially
during
during
the
the
general
general
information
information
regarding
regarding
the
the
patient's
patient's
educational
educational
attainment
attainment
as
as
well
well
as
as
his
his
occupation.
occupation.
Because
Because
right
right
there
there
and
and
then,
then
you
you
could
could
already
already
determine
determine
if the
if the
patient
patient
has
has
high
high
IQ.
IQ.
And
And
then
then
also,
also,
abstraction
abstraction
tests
tests
can
can
be
be
done,
done,
such
such
as
as
interpretation
interpretation
of
of
proverbs
proverbs
and
and
recognition
recognition
of
of
similarities.
similarities.
For
For
insight,
insight,
whether
whether
or
or
not
not
the
the
patient
patient
knows
knows
that
that
he
he
or
or
she
she
has
has
an
an
illness
illness
and has
and has
some
some
realistic
realistic
conception
conception
of
of
its
its
process
process
and
and
possible
possible
treatment.
treatment.
So,
So,
proof for
for
degree
degree
of
of
insight
insight,
by
by
asking,
asking,
often
often
toward
toward
the
the
end
end
of
of
the
the
interview.
interview,
So,
so
why do
why
you
do you
think
think
you've
you've
been
been
having
having
these
these
problems?
problems?
What
What
do
do
you
you
think
think
needs
needs
to
to
happen for
happen
your
for your
life to
life to
improve?
improve?
Insightful
Insightful
patients
patients
will
will
be
be
able
able
to
to
identify
identify
some
some
psychosocial
psychosocial
stressors
stressors
related
related
to
to
their
their
disorder.
disorder.
Patients
Patients
with
with
poor
poor
insight
insight
may
may
respond
respond
with
with
such
such
phrases,
phrases,
I
I
don't
don't
know,
know,
you're the
you're the
doctor.
doctor.
People
People
need to
need to
stop
stop
hassling
hassling
me.
me.
So
So
this
this
is
is
usually
usually
in
in
paranoid
paranoid
patients.
patients.
So
So,
a
a
complete
complete
lack
lack
of
of
insight,
insight,
yung
yung
wala
wala
talaga
talaga
siyang
siyang
ano,
ano,
yung
yung
walang
walang
masabi
masabi
talaga
talaga
regarding
regarding
his
his
illness,
illness
is
is
often
often
seen in
seen in
psychotic
psychotic
disorders
disorders
or
or
in
in
dementia.
dementia.
For
For
judgment,
judgment,
the
the
standard
standard
question for
question for
testing
testing
judgment
judgment
is
is
if you
if you
found a
found a
stamped
stamped
and
and
addressed
addressed
envelope
envelope
lying laying
laying
on the
on the
sidewalk,
sidewalk,
what would
what
you
would you
do?
do?
So
So
assess
assess
judgment
judgment
also on
also
the
on the
material
material
gathered
gathered
throughout
throughout
the
the
interview.
interview.
So
So
again,
again,
yung
yung
standard
standard
question
question
pala,
pala,
according kay
according kay
Carla,
Carla,
also
also
it
it
is
is
not
not
noted to
noted to
be
be
helpful
helpful
in
in
assessing
assessing
the
the
sort
sort
of
of
judgment
judgment
daw
daw
in
in
which
which
clinicians are
clinicians are
interested.
interested.
So
So
usually,
usually,
uh,
uh,
yung
yung
sa
sa
clinician
clinician
naman
naman
is
is
yung
yung
more
more
on
on
social
social
judgment.
judgment.
So
So did
you
you
decide to
decide to
seek
seek
help?
help?
Ay,
Uh,
so
so
when you
when you
assess the
assess the
judgment,
judgment,
did
did
your
your
patient
patient
decide to
decide to
seek
seek
help
help
when
when
she
she
felt
felt
depressed?
depressed?
So
So
that's
that's
generally a
generally a
good
good
if
if
the
the
patient
patient
sought
sought
for
for
help.
help.
Did
Did
she
she
apply
apply
for
for
unemployment
unemployment
benefits
benefits
when
when
she
she
lost
lost
her
her
job?
job?
Did
Did
she
she
decide
decide
that
that
the
the
best
best
treatment
treatment
for
for
her
her
depression
depression
was
was
to
to
go
go
on
on
a
a
cocaine
cocaine
binge?
binge?
So
So
this is
this
an
is an
example
example
of
of a of
unimpaired
unimpaired
judgment.
judgment.
So
So
that
that
ends
ends
my
my
report
report
about
about
MSE.
MSE.
Thank
Thank you,
you.
Doc.
Sige, questions? Wala question? How do you do the ano nga? Katong digits span test?
No, Doc.
Hindi manunggan, Dok. Hindi manunggan. Nawala.
Dungo ni mo man?
Yes, wait lang, Doc.
Wala, Dok. Wala na pa.
Tulungan ko. No, Doc.
Wala, Dok. Wala, Dok. Hello?
Sorry, Lino.
Okay lang, Dok. Eh.
Then, Mike.
Nay, Mike, Dok. Nalas to nga. Pwede dyan yun, Doc. Doc.
Yes.
Mandungan ka, Doc. Mandungan ka na, Doc.
Hello?
Wait lang daw na hindi kita marinig.
O, basahan na lang, basahan.
Ano eh?
Speaker, yung source na ng speaker nila. Source ng
Paano, Doc? How do you do digit span test? Nag-chat si Doc Ching. May na.
Yes, Mon.
Okay, Doc. What was the question again, Doc?
How do you do digit span test?
This is contest. Okay ba, Doc?
Ayun, tanawa.
So, sa attention, Doc, parang bigyan ng patient ng 5 to 7 numbers, tapos let the patient repeat them forward and backward.
Okay. So are you going to just say it? Or let them see? Or let them write? Unsa man?
Parang you just, Doc, parang magbigay ka ng number, Doc.
Okay. And then they are going to repeat it.
Yes, Doc.
So how are you going to tell if they have good attention?
If the patient is able to repeat those numbers, Doc, then we can tell that the patient is attentive. Because he was able to repeat those 5 to 7 numbers.
So let's say the patient is able to repeat 4 out of the 5.
4 out of the 5.
Ito nga, di ba? What if the patient is able to attentive yapon? 5 out of 7.
5 out of 7. I think may parang fair attention na But usually, Doc, in our setting, Doc, usually do the SSSP, Doc. Yung pala ng assessment attention.
Yeah, pero kung dili di kabalo og mat imohang pasyente, di ba?
So we could actually use the digit span test.
Yeah, actually you can have the patient you can do a prepared paper, no, or a card. You write random numbers, no, example 5 3 7 2 1, ana, and then show it to the patient. Can you read the numbers? Read niya, di ba? And then take out the card, then have the patient repeat it. Yeah, di ba? Pwede nga na. Okay, so ano lang, no? So basically it's for attention. It's not really actually testing for cognition, eh. Diba? Rather it's for attention lang. So kung kulang ang imong attention, what are you thinking?
Usually, Doc, pag kulang sa attention, Doc, probably situation for example, bipolar patients, no, especially in their manic phase, usually they would have what do you call it? Racing thoughts, no, and some random ideas and that. So generally, they would be having difficulty concentrating or having.
So what part of the brain has problem if you have difficulty concentrating or attention?
Frontal lobe, no?
Okay, frontal lobe, di ba? Or specifically your prefrontal cortex, di ba? So if you think of prefrontal cortex problem, then you think of what diseases?
Uh, ano to? Depression,
Okay,
schizophrenia,
schizophrenia.
yes, sir.
Ano pa?
Uh, yung other mood disorders like bipolar.
Sige, okay. Ano pa?
Medical conditions, no? Could be one worse sa bipolar.
Like unsa?
Mga tumors sa prefrontal sa medical.
Okay. Oh, sige. Unsa pa? Psychiatric. Unsa man?
Substance, no?
Okay. Sige, pwede. Substance. Particularly what substance?
Ano to? Probably